Welcome to Healthcare IT Today. I'm John Lynn, together with my colleague and friend, Colin Hung. The world of technology and healthcare ever changing in new and novel ways, and that's why we love this stuff. So join us as we discuss the latest healthcare and health IT news meshed together in new ways which help generate ideas and new perspectives. Plus, we'll have a little fun along the way. Today, we're going to be talking about a potpourri of different topics. And be sure to follow the show on social media at the hashtag HITSM and our personal accounts at TechGuy and at Colin_Hung. Plus, check out our 19 years of health IT content at healthcareittoday.com. Do you like potpourri, Colin?
I sadly do not.
I was gonna say I don't either. And I'm not a very potpourri guy, like with food and stuff. I'll eat the same thing over and over. But I guess with discussing health IT, I like potpourri.
I like the concept of potpourri. I just don't like the actual potpourri. But yes, food-wise, approach-wise, I do like it.
Wait, so are you a
I do.
smelly lotion or a smelly candle guy, or
Well,
no?
no, no. I mean, vanilla candle, great. I love it.
Oh, okay.
Strawberry, maybe, but that's it. Like, I'm not into like the different scents or whatever. So
Yeah,
yeah.
I don't care for it unless there's a stink, and then it's like, sure, crank it up, that's fine.
So I have to say to the audience, if John is sounding a little huskier today, that's because he is fighting a little bit of a cold. So
It's not because I
it's
just went through puberty and my voice finally went
well,
deep.
it's I was gonna say it's not because we're filtering your voice somehow.
Auto tune for your voice.
Yeah, auto tuning, add a little bass. No, all good, all good. Yeah, well, hey, like there's so many things happening in healthcare. It's kind of fun today, John, that we're taking on a variety of topics. Let me start, by asking you this one because it is such a hot space. That is, of course, AI scribes. First of all, that's not a new term, but definitely there's nice to be some definition now into what that is, right? The ambient clinical voice AI scribe space. What in your mind's happening, and what's notable that's happening in that space, John?
Yeah, I think what's interesting is that all of the major healthcare organizations are saying I need an AI medical scribe. And if I don't, I'm probably going to have workforce retention issues. Like that's how important it's become, where most people look at it and say, I need to do this because if I'm not supporting this the right way, I'm going to have trouble with my workforce. So that shows you how far we've come. I mean, it's amazing. We see a lot of the biggest ones choosing a vendor. I'll be interested to see how that plays out because sometimes it's good to choose early. And if you choose the right pony, you're good. But sometimes, if you choose the one that doesn't end up becoming the dominant one, then you got to switch later. Luckily, the AI medical scribe is easier to switch generally. You learn some things over time and they're personalizing stuff more, but it is going to be a different change to switch. Some have an application or a mobile, application where you can see the data. Some don't. They're going straight to the EHR. So like those nuances will make it hard to switch if you have to switch.
Yeah, this space is fascinating to me, right? Like in the span of 12 months almost, it feels like we moved from hype to must have. Right? Like, I think there was a lot of, I remember not that long ago, there was a bit of skepticism to say, is this really working? Is it really worth it? Is this any better than a transcribing solution, right? Than we had before? And then all of a sudden that switched, right? Like all of a sudden everyone's like, this is definitely have to have. Like it makes such a difference in terms of administration. No more pajama time, right? No more filling out reports later on at night. It captures everything. And, I credit, first of all, docs being willing to try it and then actually talking about it, going, it really does work. And then, I think there's been some validation from some credible third parties, right? Like a lot of associations launched their own studies and little mini experiments into the technology. I'll just cite two, like the American College of Radiology, ACR, did a study to say, how does this work for radiologists? And they came back basically and said, it really does work. And then here in Ontario, Ontario MD did a study that says, does this work for primary care docs? Does it really make a difference? And overwhelmingly, the study found the answer is yes. It cutting administrative time by 80%, upwards of. So when organizations like that are coming back saying this really does work, it's no wonder we're kind of in the mode of I need to pick somebody and go with it and get this in because I'm going to be behind the eight ball if I don't.
Yeah, and what's interesting is we haven't seen any study of the negative, and maybe that's still to come, and there will be. But you also have to compare it to what was happening before. doctors who didn't fully document everything, and now it's actually more accurate, it's more thorough. So yeah, I think we're going to find some negative things throughout the time, and there's probably going to be some slip ups where maybe they update the model and the new model isn't as good as the previous model, and that's going to frustrate some doctors. We're going to go through those growth cycles. But you're right, it's amazing how much it's become I need to have this in so many places. The other one that's interesting for me is how many human scribe companies have become AI medical scribe. And it's great for them because their model was originally built on $1,500 a month, which ironically, that kind of shows you what the market is for an AI medical scribe, that a lot of doctors were willing to pay $1,500 a month, and now they can pay $100 to $300 a month for that essentially same service.
Same service. Yeah.
So yeah, it's amazing how much the price has dropped for it and how many of those long time physical medical scribes have become AI.
Well, and the other thing I think I note about this space is just the players, right? We know that there are some big name leaders out there. I mean, no one's surprised, right? Companies like Nuance and Nabla and Abridge and Ambience, these are companies that a lot of people have heard of. And then there are a lot of smaller players, right? Niche players who have come up with single standalone solutions, maybe for a particular specialty or a particular type of application of AI scribes. So it'll be very interesting to see how that shakes out. And I think given the time frames we've been experiencing, it's going to be like the EHR market on steroids in the sense of there's going to be lots, and then all of a sudden we're going to be down to a few a little bit later on, just because I think we are in a very, very fast land grab. You've got to get a lot of customers in order to stick around.
It is interesting. I'm not sure I agree completely in that. I'm not sure how they're going to consolidate. Like, I'm really interested to see, is it a customer consolidation and does that make sense? I guess, it probably will for some, especially if maybe they're focusing on the same ambulatory segment or something along those lines. That would make sense. But what's fascinating is like even the small, as you kind of phrased it, like the small AI medical scribes are not that small. And I always saw this with the EHR vendors. When you have someone paying you 100, 200 a month, and every month, and these are doctors, like that's you don't need that many. You have 1,000 of those, and it's an amazing business already. And so I'm interested to see how that plays out because 1,000 doctors paying you $100 to $200 a month becomes a pretty big business, and then you can grow from there. So I am interested to see how that consolidation happens.
So, on a related note, then, John, do you think the EHR vendors are taking the right approach with AI in the sense of, some people have picked a dance partner, others have taken more of a best of breed approach, kind of letting their customers choose and pick and making it a little bit more agnostic. Others have decided to build their own. What's your take on the approaches that EHR companies are taking?
Yeah, when it comes to a medical scribe, to be frank, I'm not sure. Like, I'm not sure the right approach. I do hear the case for being deeply embedded in the HR matters and being able to leverage the EHR data matters. You hear that from Modernizing Medicine or ModMed as they're called now. Elation Health does that as well. Even Innovacer, they had a data product originally, right? It was like an analytics and data product, but now they can use that to inform their AI medical scribe. So now you don't have the errors where the AI medical scribe makes them female when they're male because you already have the data and know that they're male or whatever it might be. So I think that there's a case to be made there. But all right, that's fine for now. A little bit, 3 months from now, 6 months from now, the EHR vendors make that data available. Everyone has it. Does it really matter? I'm not sure it is, right? So, and then here's the other question. Do the EHR vendors need to own that or do they not? I asked Epic this question and I said, hey, what do you think about this? And they said, well, the maturity of the AI medical scribe is so much, we don't need to build it ourselves. So we'd rather just partner with a bunch of others that are doing it already. So that makes sense to me. And they have enough dominant market position. Yeah, that makes sense. Whereas Oracle's taken the opposite approach. We should build it all. I'm sure they're still supporting the other AI medical scribes if their customers want it because theirs isn't quite ready, but they're building their own to compete with someone. So that creates a funky dynamic in its own right. So it's going to be interesting to see it play out. And then, just to finish this portion for me is what happens like for the EHR vendor? Do they need to acquire an AI medical scribe? So if they're partners now, do they need to acquire it? And can they acquire it? So in some cases, the AI medical scribe may be a bigger company than the EHR vendor, I could imagine. So we'll see how that plays out.
Yeah, I'm with you. I'm not really sure how it's going to play out. I think all those models work, right? I mean, one hand, you can kind of look at an AI scribe and kind of go, well, is it not the same as a data visualization platform or a graphing tool? Like we don't really care which one was underneath and doing the dashboards. As long as it worked, you're fine, right?
Could
Like
be a fax server. You just tie it in and it faxes it.
right. So, in that sense, you kind of go, well, are we at the point or will we get to the point where it's just a commodity? It needs to work. And I don't really care what, whose model it is or whatever. As long as it works and it works well, I'm good. Right. And there won't be a demand to say, well, I want A versus B because B is slightly better in this application. I mean, there might be a few people like that, but I think the majority might not be like that. Or is AI going to evolve so specialized where you're going to have an AI for psychology and behavior health that it's very different than the AI for, pediatric care. And therefore the one size isn't fit all. Like you need multiples. I'm not sure because I think the science behind AI is still evolving. Like the efficacy of some of these tools is evolving. So I'm kind of see who's going to hedge their bets. Certainly, I think the one that right now most people are going for is picking a dance partner. I hear more and more EHRs going, well, I'm going to go with one for now, and maybe I'll think about making myself agnostic down the road. But for now, I'm just going to work on this one and deeply embed it because things seem to be tied so closely together in terms of workflow and these AI scribes.
I think that's truer in the ambulatory space where the practices don't have as much power. In the health system space, I think, the Epics, Cerners, Meditechs, I guess Oracle Health, not Cerner. They should, they have to. If their customer wants it, they have enough buying power that they have to support it. So that's interesting. But if I look beyond the AI medical scribe, I think, there's a lot of EHRs missing the mark. And here's where I think they're missing the mark the most. They're not communicating their AI strategy. They're not sharing what they're going to do and what they're not going to do, where they're going to partner and when they're going to build it themselves. And I get some of it, right? They're afraid of competitive pressures and people copying them and things like that. I mean, we see some of the work that eClinical Works is doing. We've been, able to go to a lot of their user events and hear the plethora of AI things. I mean, just look at the call center one that they did. I haven't heard anyone else do that, so I guess they're not copying, so they don't have to worry. But it is interesting that they chose to do that, right? And anyone that works with eClinical Works knows that they like to build stuff, and so they probably come in with that awareness. But I'd love to see EHR vendors describe, hey, are you going to do inbox messaging, the way Epic's doing that? I probably don't want to compete with that if that's happening, right? Whereas some others may be like, no, that's not a priority. I don't want to do that. Let alone, are they going to do a platform for all the AI clinical innovations, whether it's radiology reads, whether it's clinical decision support built on AI on top of imaging or on top of other lab data? Like, I think that EHR vendors need to have a better vision for where that's headed. And I think it's an opportunity for them to essentially become the platform for all of those AI innovations and enable all these startup companies, if you will, to be able to do that. That's kind of what ADOC's doing, and so, they could just partner with ADOC to do something like that. Zelth kind of did this in the app space, if you remember them. I think we need the same in the AI space, and we need EHR vendors to kind of give that vision away so that people know what to expect.
Well, and surprisingly, Nuance is doing this, right? Microsoft is building their platform in such a way to say, listen, if you don't like our AI platform, you can plug something else in. If you want something else other than Copilot, feel free. And there's a mechanism, it's still early stages, but there's a mechanism in their framework to allow for that. Because you're right, when you extend beyond AI scribes, you're getting into, well, there is an AI for patient engagement. There's an AI for optimizing email sends or fax sends. And, I'm pretty sure that's a very different AI company than the AI scribe one, right? It's a very different application. So you can't have a one size fits all single AI platform to do all of that in the background. So in that way, if you think about the more AI in the broad sense, you're almost forced to go, well, I need to build my platform agnostic because I need to be able to plug in different things in here, each with their own purpose that go beyond scribes.
Well, you bring up nuance. How long until Microsoft says, hey, as part of Office 365 are all these AI tools that are HIPAA compliant, that blah, 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 right? Like they could solve a lot of those tools. I mean, it's not quite one platform, but we know what the number one analytics platform in healthcare is. It's Excel. And it's not
Right.
because it's the best analytics platform, it's because it's free and it's pretty easy to use. So,
Right.
yeah.
Absolutely. And hey, if you're just tuning in, you're listening to Healthcare IT Today with John Lynn and Colin Hung. Today, we're taking a potpourri approach to the hot healthcare topics. So, John, let me ask you this next one. What is or will be the impact of all the government cuts and disruption on health IT?
Yeah, I mean, to me, that's the core element. I go back to a previous episode. People can go, check out the receipts if they want. But I still predict health IT is not going to be massively impacted. The biggest impact will be whoever they choose as national coordinator and what power that position still has. That's going to impact TEFCA. It's going to impact EHR certification. It's going to impact some of those things. And so that will be the biggest impact. But the rest of the stuff for me, it's going to impact, it could impact health, could impact wellness, it could impact research. I don't know enough about those to argue either way. And then I do think there will be some trickle down impact of cuts to Medicare and Medicaid. And so then provider organizations aren't paid as much, so then they can't buy as much IT. And so then there's kind of this trickle down impact that happens. But policy wise, I just don't see much. I actually think it will probably be a net positive. I think some telehealth thing could pass. And telehealth could be like instituted going forward and finally be permanent as opposed to this every 3 to 6 months we have to go through this rigmarole again. I think that could be a positive. I think some privacy stuff could be a positive around security and privacy. So, but I think outside of that, I actually don't see that big an impact.
Hmm. I am going to disagree with you there. I think the cuts are going to have a very big impact, both direct and indirect. I think the direct, obviously, we're seeing already a huge impact on research. And of course, a lot of the research was being done at academic medical institutions, right? So I think their budgets and their operations are going to get very tight and very squeezed. I do agree with you in one sense that I think IT and digital health projects that were already in flight, I don't think there's any change in that. I don't think there's any policy coming down that they're like, oh, I need to freeze that. But I think given the amount of disruption and the lack of clarity on what future disruption may be, like there's not a plan here, like a clear one anyway. Um, I think people are going to go, well, you know what? Let's hold off on making any new investments. Let's hold off in case we have to go and pivot to do something, right? That comes down the pipe that's going to impact us. So I do think there's going to be some impact on that. Any new projects, I think, are going to get delayed. I also think that just in general, we're going to see fewer and fewer payers, providers, and government people at healthcare conferences because I think that's an easy budget to cut. And when times get uncertain, they're just going to be like, okay, let's turtle, right? I think that's going to be a challenge, frankly. So we're going to see that impact. And I think just given what's happening in the regulatory space around FDA,
Hmm.
especially, we've already started to see it, right? With the whole thing with the GLP-1 drugs, where they suddenly made it no longer, where a generic can be a compounded one can happen. The whole industry just got basically wiped out overnight. I think that may happen. Unintended, I think, but I think some of these things are possible. So I think actually disruption could be quite big from all of the stuff that's happening in DC.
And you're right, conferences are going to be impacted. I was told no one from ONC can go to HIMSS. I don't know if that's true. I heard someone that was a rumor. And it would make sense, like you said, that hey, it's the easy place to cut. You go into Vegas. We already know that's kind of a black eye on government in general. Although I think it's short-sighted because the ONC people that I know go to Vegas for HIMSS go and talk about health policy because they're health policy nerds. So, that's interesting. And I think that will determine the impact is what happens with ONC. Under the previous administration, it was elevated to ASTP, which was an assistant secretary, given more broad, powers and controls. If it's put under CMS, then it actually limits its controls because it can only do with what's within CMS. So I'll be interested to see how that comes because that could be a big impact as well.
Yeah. I think there's definitely to me it's going to be very very interesting to watch this, right, and to see the impact. I agree with you though that there's a lot of IT stuff is probably not going to be impacted by any policy change. It's so far down the priority list, right?
Well, and
um
it's interesting too. There's a lot of really amazing policy people at ONC and CMS and all this, is they flood the private sector. What does that mean? There's some really intelligent ones that have done great work. You know, don't get me wrong. I'm not sure that's the right move and all that, right? But hey, that influx of talent could help a lot of companies do some really good things.
that's true, that's true. All right, let's get to the final question, John. This one's an interesting one for me, because we've experienced this just recently, but generally it's a concern for organizers of events. Is badge sharing at healthcare conferences really a problem in your mind?
Well, I mean, it's a challenge, right? And if you're an organizer, of course, you only want people with a badge there, and you don't want freeloaders. There is a challenge though, which is that if they don't share, guess what? You're not getting any more money. So that's generally the case from what I've seen. They're going to find something else. They'll meet at a hotel. They'll do something else, right? Or they just won't come. So does it actually impact them in a big way? I'm not sure, but it did feel like an overstep by Vive to me to put the wristband on. Maybe they said it was security, and I get the overtone of the payers and not wanting certain people there, but it didn't feel like that to me. And I mean, the execution of it was really poor.
Yeah, I mean, there's no doubt badge sharing happens, right? Like, and I gotta be honest, I've been guilty of it, right? Where I was only able to come down to a conference for one day, and then I gave it to a colleague on the next days. But to your point, I don't think they would have gotten any more money. Wasn't like we are going to buy two tickets. Like, if anything, that would be like I just wouldn't have gone because I was only there for one day, and my colleague would have gone. So it's just still one ticket or one badge,
And should
right?
that justify them trying to make people not do it? I don't know. It's a tough one, right?
Yeah. Yeah. So I mean, I understand the rationale behind it. I think you seriously have to look at how much are you really losing here? And is it worth all that effort to save 2%? Right? Like, is this sort of a 2% problem that's happening? And who is really sharing? I think a lot of bad sharing that happens is actually around support staff and not people who really want to be there. Like it's like the videographer, right? It's the booth person that's coming in to help you like manage the physical booth itself. Like, I think it's those people that are sharing the badges more. And like, I don't really think that's the audience for the conference people, right? So
Yeah. I mean, we face it too, right? At Sway Health, people sharing badges. But, what's interesting is we'll have people reach out to us and say, hey, they can only go one day, but can this other colleague come? And we're like, sure, that's fine. But that's the problem is if conferences were more flexible in how they manage their badges, then there would be less badge sharing because, did pay for a full badge and they can only come certain days. Like, they should offer some flexibility there. That's why we do it in Sway Health. It just feels like the right thing to do for the community to do it. That said, I have come across people who, one that was really famous. I was walking around a conference and he said, "Oh, I went to your conference." And I thought to myself, I knew every person that registered. I'd never seen your name. He's like, "I didn't pay, but I went and I'll pay next year." Anyway, it was interesting, but so, it happens. But what can you do? That's the hardest point. I think if you do get caught, you deserve a penalty, right? And not to be allowed at the conference in the future and things like that, right? I think that's reasonable.
yeah, I think so there's some of those things that I think can be done that are within the powers of the conference, right? To say, listen, if you get caught with someone else's badge for not a good reason, meaning you didn't forget your badge, you just need a badge to get in to get your own, that's fine, right? But if you're wearing someone else's badge and you're walking around and someone catches you, you could be banned for a year, 2 years, and pick a number. And I think that's significant, right? And how embarrassing would that be for that company, right? Right? To have that happen, especially if it's a large one. So I think that alone could be. I mean, you could implement, not that I recommend this, but you can implement a wall of shame, right? List, right? Like kind of those types of things. So if you really want to prevent it, there's some other mechanisms versus going through and doing the wristbands and other things, and frankly printing outdated pictures on people's badges and stuff, right? Like, I don't know how, like, they print them so small, I can't tell the difference anyways. Like, it just looks like a circle on most
Yeah, well,
badges.
and we have that whole, white people can't tell what Asians look like. Asians can't look what white, like they all look the same. All the Indians look the same to me. I don't can't really tell, but and it's an older picture. How do you really know?
Yeah.
Especially as they're walking by, that's yeah. I didn't like the wristband though, and ironically, I didn't even stop some people because some people could get it off and then just trade it anyway. So it's like, wait a minute, that didn't really solve the problem. But then it was even worse because it's like, wait, I shower with it, now it's soaking wet, and I'm like sitting there with it soaking wet. That it was bothersome, And yeah, obviously I still attended and it was fine and I survived, but I just feel like there should be a better way.
Yeah. Yeah. I think so too. But hey, and we're right in the middle of more conferences. So we'll see how that one plays out over the next little while as well, John. Well, we're at the end. Thank you to all of you who tuned into this episode of Healthcare IT Today. To find out more details about our show, check out the programs page on healthcarenowradio.com. And please share your voice and engage with the community at healthcareittoday.com and on social media using the hashtag HITSM. I'm Colin Hung, along with my friend and health IT collaborator, John Lynn. Thanks for listening, and have a great week.